When you're giving your presentation, so you did your qualification now you're doing your presentation, right? To give an effective presentation, you as a salesperson, you as a marketer, needs to properly prepare for the presentation. A lot of marketers out there think that they can actually just lollygag and just go ahead and just wing it. No, there is a proper way to create a presentation. You must prepare that. You ever watch these TED Talks? You ever watch these amazing speeches done by the Apple Corporation, by Microsoft, by Google? You think that they actually winged it? No. They actually took time to practice, to drill, rehearse, create nice presentations. You have to make sure that you prepare for this. So I'm going to give you guys some of the basic things that are involved in your presentation. And I'll give you an example here. If you're watching this video right now, do you think that I just started talking nonstop? No, I actually sat down and I wanted to be able to be clear to deliver you guys the message that you guys need, that I want to share with you guys. My slides, that took time to be able to be made. I didn't just slap things together. A lot of people out there with their PowerPoint presentation, they're still using PowerPoint presentations set up from the 90s. And that is far from what you should be doing. You should be marketing the way people are marketing currently. That's why you're seeing a lot of our training, a lot of our services that we're doing. We're putting it in Facebook, we're putting it in YouTube, we're putting it in Instagram. We're doing it by mail, we're doing it by email, we're doing it by text messaging. Whatever we're doing, we're marketing in the current state of the nation. So now, let's talk about just the presentation. Your presentation should involve investigating the prospect company, right? The reason why is you need to be able to tailor it to them. If I'm using a PowerPoint presentation, I'm going to make sure I include their logo in it. You need to be able to make sure during the questioning phase, during the presentation phase, you're formulating questions to clarify the intelligence already collected. You need to make sure that the presentation equipment works. So if I'm doing a presentation, I need to make sure that my computer, for example, is charged up. I need to make sure that if I'm using my tablet is charged up. I need to make sure that I have multiple copies of the file just in case one file doesn't work. I need to make sure I have a backup. So just because I'm doing a presentation with my computer or my tablet, I actually have the presentation printed out. Other than that, I already have a short note, a one-page presentation page that has the bullet points, so I know I can use that instead at times. I'm going to make sure that I have the printout of the PowerPoint presentation. If I'm using a PowerPoint, I'm going to have that. You have to make sure you're prepared and everything works, and be prepared for something that happens. You need to be ready to answer nasty questions, such as, what's wrong with your product? Here's the funny part. I had a doctor once ask me, I don't want to refer my patients to home health because of all the fraud that's going on. How do I know that you're not a fraud? How are you going to answer that question? How would you answer somebody telling you that your industry is full of fraud and I don't want to refer a patient to you? I want you to think about that right now. So one thing that we teach a lot is preparing for objections. That's just an objection in a complaint. I would say, doctor, I totally agree with you. There are a lot of agencies in our industry that are committing fraud. And I would say that that is a sad thing. But in the end, doctor, the services are there. The patients need it. Now here's the thing, doctor. That's the last thing I want you to be able to be thinking about our organization. And just like other physicians out there who are doing bad things as well, just as other agencies out there that are doing bad things, that's not us. And I want full transparency with this. And my goal is to make sure my nurses assess the patient correctly, make sure you're communicated with. I can also assure you this, I can give you a sheet that explains the Stark's Law and the anti-kickback laws, and there's none of that we're asking from you. All I'm asking from you is that if a patient needs home health services, and by the way, here's our decision tree, to be able to determine if a patient needs home health services. And if the patient doesn't, doctor, don't refer them for home health services, even if they're asking it. You can even give this to them if need to. So if a patient is required, and under the law, under the requirements of Medicare insurances, they say that the patient qualifies for home health, then refer them for home health. We'll take care of the patient. We'll communicate with you. We'll be full transparent with you so that you don't have any other objections other than that. And doctor, other than you thinking about fraud, is that the only thing that makes you make a decision to try to refer a patient to us? What other things do you have or are you thinking other than the fraudulent problems that other agencies and other physicians are doing? Is there anything else other than that I can solve for you right now so that I can get your commitment to start working with us? So that's something I would say. Now you're probably asking, Michael, that's a lot of words. Of course it is. But I need to be able to, first of all, I agree that he believes that all home health agencies are fraudulent. The next thing I need to do is isolate that by me asking, other than the fraud, is there any other reason why you don't want to refer to home health agencies? I'm going to ask that question. Then I'm going to also say, hey, these are the solutions that we've done to be able to show physicians, show referral sources that trust us, why we don't do fraud. I need to be able to have those in a presentation and be ready for that. To be ready to answer these potential objections on a variety of different places, like right now, for example, this is the presentation phase. A physician brings up an objection. What I need to do is I need to be ready for that. And that's where our objection series is, where we teach you guys what are the potential objections you're going to face in every step of the way, from your prospecting to your greeting, to your qualification, to now your presentation, to your close, your proposal, and then your follow-ups. You must be ready to be able to know how to respond. That right there is important. And the last thing is handling disaster related to Murphy's Law. Pretty much Murphy's Law says if bad things are going to happen, bad things are going to happen. So things will happen. It's how you handle it when you're faced with it. Do you get down on your knees and beg, or do you stay up and handle the objection, handle that problem, and find out the solution?